Thank you, Kevin. Yes, nurses are the most trusted profession, I think 19 years in a row, and we're over 3.5 million strong, so I believe we're gonna help change the cannabis industry. I'm excited today to have this panel here for everyone, and we'll start out by brief introductions of about a minute each, and then we'll get right into our Q&A. So I'll start with Elisabeth. Tell us who you are, what you do, and maybe one fun fact about yourself.
Okay, well, thank you. Greetings to you all, and happy Mother's Day to all the moms. I'm Elisabeth Mack. I'm the founder and CEO of Holistic Caring and the Green Nurse, and of Bloom Hemp CBD. We do patient education and nursing professional education, as well as caring for patients across the spectrum. Bloom Hemp offers free email care plans and nurse line, which is really unique, which I love about really working in patient care, and so that brings us right into the heart of it. So I came to cannabis, like many, after an injury. I crashed my bicycle in 2014, went out on leave from Anthem Blue Cross to have surgery, and actually didn't go back. I found CBD and I said, wow, if this can help me, I have to help heal others. And so that's what I set out to do, and been doing that ever since, the past decade. A fun fact about me, I actually was a candy striper all through high school. So now I have been in healthcare for 40 years.
You don't look a day over 25. Miss Megan, tell us about who you are, what you do, and a fun fact, please.
My name is Megan Bang. I'm the founder and CEO of Trusted Canna Nurse, where we empower patients to heal themselves with cannabis and psychedelics. I just graduated with a master's degree in medical cannabis therapeutics. And we developed our own line of high quality CBD products. Interesting fact about me, I am a competitive pole dancer and was just featured in the recent sports issue of Fat Nugs magazine.
Hope you brought copies. All right, Miss Laura, tell us who you are, what you do, and a fun fact, please.
Hi there, I am Nurse Laura Barrett. My business founder and CEO is Ask Nurse Laura. Find me on Instagram and follow me, please. And I do cannabis education for dispensary staff, provider groups, nurses at some hospitals, and really anyone who will listen. I'd be happy to do a group education with that business. I also have an organization called the National Clinical Director Consortium. It's a group of healthcare providers, nurses, physicians, and pharmacists who all work in this role, which in Maryland, where I live, is called clinical director, supporting patient and patient education for patients who shop at dispensaries, mostly medical, but also some adult use patients. So if anyone's interested, you can look us up and join our organization. I do advocacy work with a nonprofit called the Connor Sheffield Foundation, trying to do what I think we heard a preview of is getting access to medical cannabis in hospitals and healthcare facilities by changing the rules and the laws. And I also teach at the University of Maryland Masters of Cannabis and Science Therapeutics program. Thank you.
Thank you, Laura. Christina.
Funny little thing
Oh, yes.
about
What
me.
is your little...
I was Sister Laura in high school. I joined the convent right out of high school. I was supposed to be a nun, not a nurse.
That's an interesting change of direction, yes. Miss Basima, please tell us who you are, what you do, and your fun fact.
Yes, I am Basima James. I am a bedside nurse. I've been in critical care. I've been a nurse for 9 years. I've been in critical care the past 3 years. I am the founder of Cannabis LLC, which is my business that gives cannabis educations to consumers, more so in the light of those who are still taking pharmaceuticals. So showing them how to incorporate that into their life safely and effectively. And my fun fact is that I ground myself by jumping out of planes. So I've done 2 jumps already and I'm working on my 3rd one.
And last but not least, please tell us who you are, what you do, and your fun fact.
Yes, thank you. Happy Mother's Day, everyone. It's so awesome to be here. My name is Ariane, and I'm also known as the Kind Nurse. I work at Trusted Canna Nurse with Megan, and I'm the patient director of care services there. And what I do is I empower people, like Megan said, on their holistic health and wellness journey through conscious cannabis use. use and psychedelic integration. I've been doing this for a few years, but I've been a nurse for 16, with my main background being in ER and critical care. So a fun fact about me is that I really enjoy the practice of shibari. I've been doing it for a few years in both solo practice and partnered, and I find it to be a very meditative and grounding practice.
You gotta tell me, what is shibari?
It's Japanese rope art. Yeah.
Well, and thank you to Trusted Cannabis for sponsoring this panel. We'll go ahead and start with Elisabeth, also known as Mack, which I might say often here. So give us some insight on the historical development and background of cannabis nursing.
Well, cannabis nursing has been a thing for about 20 years, but thanks to the ANA last year recognizing cannabis nursing as a specialty on September 27th, the day after my birthday, it brings us into a broader inclusion of nursing practice and healthcare and hospital careers, as well as building bridges into the cannabis industry. This milestone recognizes not just the culmination of tireless advocacy, but builds, a beginning of a new chapter in nursing specialization of cannabis nursing. So the achievement recognizes, the grit and the tenacity that all of us have had to be able to be in this industry. For me, the past decade, and you more than that. And but it goes all the way back to Mary Lynn Montre, to founding nursing. Patients Out of Time and American Cannabis Nursing Association, and all of the other past presidents. So Mary Lynn, we salute, Eileen, Carrie, Eloise, Llewellyn, Rachel, and Nicole. So thank you to all of them. And we also must recognize Heather Manisobel, Nurse Heather, in the Cannabis Nurses Network, for being that light for many in the cannabis nursing landscape. And so hats off to all of these ladies and all of the nurses that are working, all of us that have laid the groundwork. It's tireless advocacy, but we're seeing the light at the end of the tunnel, and I'm very excited about the next decade. So thank you.
I think that's really, we need to pause there for a second, because the American Nurses Association has recognized cannabis as a specialty, cannabis nursing, which is historical. And it didn't happen easily or quickly. We'll talk more about that tomorrow at the breakfast. So for those of you who are interested in learning about our scope and standards that ACNA developed to help us get to the ANA recognition, please join us tomorrow. But where do cannabis nurses currently fit in, Megan? And what is our current role? But most importantly, how can cannabis nurses make a living?
Great question. So right now, there really isn't a place, there aren't cannabis nursing positions either inside of cannabis or inside of healthcare. So most of us have had to pave our own way and do our own thing, which is why we're sitting here talking today. Outside of positions like yours at Stanford, being able to do what you do. We've so far had to pave our own way. We'll see what happens with Schedule 3 or rescheduling, if that changes.
What advice would you give nurses who want to make a living in cannabis nursing, other than paving your own way? You have a few seconds left. Any tidbits you'd like to share?
Don't quit your day job. It's a big one, I would say.
That is excellent advice. Back to you, Mack. How would you like to start with a patient journey for us, and tell us, how do nurses working privately coach and guide these patients who are using cannabis as a medicine?
Well, most patients that are true medical patients really do well with a one-on-one personalized appointment, and they need that because we've contextualized healthcare for them, but we haven't done that for cannabis, right? So first off, we have to meet them where they're at, talk about their goals and objectives, and what they're looking for cannabis to do in their healthcare journey, right? And none of this is covered by insurance, so it's all out of pocket. But it's well worth it because we expedite their care and their treatment, and shortcutting that helps them limit the experimentation process, which saves them time and money, and gives them better outcomes right away. But in a one-on-one appointment, we have to assuage their fears by basically talking about the history and the research about cannabis, opening up their minds, teaching them a little bit about the endocannabinoid system, but not too deep, but basically telling them they might have an endocannabinoid deficiency, why this works as medicine, and how these compounds bridge the gap from what they're not getting from their food and nutrition, their rest and connection, and it kind of works like vitamin D. That's how I explain it many times. And once we get past that, then we tell them about the difference between CBD and THC, the different routes of administration, that they don't have to smoke anything, they don't have to be high, and really, cannabis is not one thing. And really, once we fast forward that, they get going and they're happy to be able to say, wow, why didn't I do this earlier? I could replace a bunch of pharmaceuticals, and this works much more naturally and gently. And so, personalized appointment, we give them tracking logs and a way to manage the efficacy as well. And really following up with them a few times is really critical. And then, every once a year, I give some of my old patients a call and just to see how they're doing, making sure they didn't fall off the wagon too much and go back to the pharmaceutical route.
That's such a great example of patient-centered care. Yeah, thank you. I think this is for you to ask Laura.
Oh, yes, right, sorry, I put my notes down. So yes, that's the one-on-one personal appointment. So Nurse Laura, tell me what you do in a dispensary.
Thank you very much. So, as most of you in the audience probably know, if you're at a cannabis conference, the laws are different in every state, right? So every state has dispensaries that operate differently. Some states have required pharmacy on staff all the time. Like if there is a patient, if the doors are open, you have to have a pharmacist there to check allotments for medical patients. Some states have pharmacy tech roles, and in Maryland, we have a particular role called the clinical director, which probably means nothing to you if you don't live in Maryland or aren't in my organization, National Clinical Director Consortium. But clinical directors are just healthcare people, nurses, doctors, and pharmacists who get paid by dispensaries, hopefully generally get paid by dispensaries to consult their patients. So to do this private consultation for money, but not paid for by the patient directly, paid for by the people that hopefully are making money, the dispensaries who are making money on the sale of those products. And in Maryland, it's a requirement. What a blessing that even as we moved towards adult use, our regulators and legislators kept this requirement that there has to be this role, this person, a healthcare professional available. Not on site all the time, not always available, but free to the people shopping at the dispensary. And so I get to do this private consultation, sometimes on site at a dispensary, sometimes over Zoom, especially since COVID, a lot of Zoom or in small groups doing group patient education. And one of my goals is really to spread the word and help more states through Canna and Regulators Association to get more states to take on this approach, that you should have some type of healthcare professional. Of course, we're all nurses, but I am supportive of nurses, doctors, and pharmacists having this role as long as you're not also the recommending provider, because you shouldn't be double dipping. But having this role to help provide the education. And in that role too, we help to educate the dispensary staff, because I'm a huge fan of dispensary staff. They know a lot about, especially strains of flower that they have in their shop. They know a lot more about those strains that come in and out every day than I might, since I'm not on site every day. But I can really help more that medical person with a list of drugs and a list of conditions that, a bartender who loves weed and works at a dispensary and knows weed really well can't probably help the patient as well with. So it's a really great opportunity, and I encourage you to talk to your legislators about getting it in your state, or talk to me and I'll try to help.
Thank you, Nurse Laura. I imagine you get a lot of older adults that come in and have questions, and so Megan, I'm curious, what kind of education is necessary in the older adult community, and what are some unique ways of educating them besides dispensaries?
Thank you. If anybody has known me for a little bit or followed me on social media, putting out short form educational content is my favorite way of educating. Mostly the younger people who are on social media. I find that the short form, keeps their attention for a little bit, but also challenges any misconceptions, any myths that they have, and gets them curious and wanting to learn more. And that's how I've been able to grow my business for 2 years now, is putting out this short form content. In terms of teaching older adults, my thing to do is go into the senior living facilities and provide educational classes. This is something that I don't get paid for, but I am able to offer the product, so that kind of makes up for the time. But there are different ways of getting paid as educators, and Laura has found a way to do that.
Yes, I'm all about getting paid. We work hard, we went to school too. We deserve to get paid for what we do. And I think we've talked about this even just in practicing for this presentation. We're nurses, we just want to help people, we want to give back, and like we think we're volunteers, but we need to get paid. And so one of the things that I've learned over time, I've been in this for a decade as well, pulled into the cannabis industry kicking and screaming. I really was not a fan prior to 10 years ago. It's pretty amazing that now I'm like advocating everywhere for cannabis and psychedelics. But a lot of these assisted livings, a lot of nonprofits have health education, wellness education, grant money, lots of grant money. And all you have to do is tweak the way you put in your application, tweak the way you present it to them, encourage them and help them write up how they're going to request the funds from the grant money they already have, and they will pay for the presentations. And it's a great way to still get the education out there. And also, groups like Mensa, I was lucky enough to present to a room of really, really smart, high IQ people with Mensa this summer, and they asked their members just to contribute. They want the information. They were happy to pay $20 a person, and I got paid well. So it's just, we have to not be afraid to ask. And I think so many times as nurses, we just want to serve and we feel bad asking. And so I've decided to start encouraging people to ask for money.
I love that. Yes, we should be paid. Ariane, I have a question for you. I think one of the most polarizing topics in cannabis is cannabis use disorder, and it is real, although I probably see it in 3% of the patients I work with. Tell us about how you approach the patient who may be suffering from cannabis use or dependency.
Yeah, this is a really delicate subject to have, or topic to talk with anybody about when we're talking about their cannabis use. And when I work with people, I ask questions. So this is self-identified. I'm not telling you you have a problem. Like, can we figure it out and you identify it on your own? And I can appreciate that only 3% may be what you see, but we see a lot more. And it's a delicate conversation to have, right? So the way I started is really asking people, like, why are you using? What are you using for? And is your use actually helping you thrive in life? Because if it's not, then let's have another conversation about other ways that we can support your endocannabinoid system and get you back on track to where your use is helping you thrive, because this medicine is very powerful, right? But a lot of people just don't know when it's gone too far. Some people will be using and then all of a sudden they're not getting the same results even though they're using a large amount. Or what we have seen is that people are using larger amounts and then they're starting to develop symptoms of anxiety, depression, insomnia, and even gastrointestinal issues, which is a big problem. You know, people are ending up in the hospital with that. When I was working in the emergency room, I had seen 2 people during the time, and I'm in Texas, and this was 6-7 years ago when I saw it. So it is something that I think is becoming more prevalent. So just having the conversation and making people feel supported, seen and heard, love and compassion. Megan and I did a group last October, a beta group for a tolerance break group. We'll be talking about it in our poster presentation, but overall, people's use cut down quite a bit. They saved a lot of money. They also built a better relationship with themselves and with the plant, which was the goal. So, but I feel like for us as cannabis nurses, it's really important for us to understand how to have these conversations, educate, ask the questions so that they don't end up in the hospital, because, I mean, Basima is still working hospital bedside, and she has stories that she can share from that and why it's important.
Yes, being at the bedside, I definitely seen the challenges of having a lack of education and awareness around cannabis as a nurse. The gastric issue that that was spoken of is called cannabinoid hyperemesis syndrome, and this is presents as severe vomiting, nausea, abdominal pain, and the problem for us at the bedside is that this mimics a lot of other disorders in the hospital. So oftentimes it gets misdiagnosed, and we're doing unnecessary interventions and treatments trying to find a cure for the patient, try to make the patient more comfortable, and we're missing the mark. And this is unfortunate for the patient because something as simple as education before or even in the early stages of CHS could have solved this patient problem and avoided a hospital stay. Now, if the opportunity for education is missed, the patient could go into the late stage of CHS, which will require them to be hospitalized due to things like dehydration, electrolyte imbalance. And for me, I believe it's very important to have nurses at the bedside that are knowledgeable of cannabinoids, endocannabinoid system, and issues like CHS and how to combat it, because it promotes better bedside care. And that education should entail knowing about the interventions that the doctor may order to treat CHS. For instance, capsaicin, which is an active ingredient found in chili pepper, is shown to be very successful in people, especially those who found relief in hot showers when they're dealing with CHS. And this was particularly important for this case in the hospital because the patient that I encountered had frequent requests for showers. And by request, I mean he will unhook himself and go in the shower, and then we'll find him in the shower. That's not safe. But knowing that capsaicin is a viable option to treat the condition, we was able to get that for the patient and keep the patient safely in the bed. So just having that knowledge comes a long way. And the nurse may expect other interventions like Zofran for antiemetic, IV hydration to deal with the dehydration, and oftentimes we have to give the patient like anti-anxiety medications or benzos because this could be a scary experience for the patient. So a nurse being knowledgeable can build a better rapport with that patient, give that patient great education that will not only help with the compliance in the hospital, but hopefully set the standard for that patient outside the hospital setting.
That's such a great example of how education among nurses can really change the course of treatment for the patient. I think it's also important to recognize that they may simultaneously be having withdrawals if they're a really high consumer in the hospital. And Ariane, I'm curious, do you think you see a higher amount of cannabis use disorder because of your openness and the work that you do, and so patients feel more comfortable coming to you because there's not so much judgment, there's an openness, there's this patient-centered care? Because I think what we see often in the hospital, I hear so many stories now in my work that I do at Stanford of like, I can't believe I get to talk to somebody who knows about this, who's not going to judge me. So yeah, I'd just like to hear a little bit about what your thoughts are about why you see a higher amount.
Well, I mean, a lot of it is because of the content that Megan creates, right? And then we ask questions about how much people are using and what their use patterns are, and that's where it's coming up at, and people are saying that they're using what 7 grams a day, I think was what some people was talking about. Like, that's crazy. It's a large amount. I don't know how people can afford some of this stuff. And when I started talking about about taking tolerance breaks is really, whenever I start talking to people about taking tolerance breaks is whenever they come and they start asking questions to me like, do you think it's time for me to take a break? Do I need to do it? And I'm like, I don't know. Let's talk about your use. Like, where are you at? How does this feel for you? Because tolerance breaks aren't appropriate for everybody. It's something that's also like a caveat in this, right? And also, like, can we help them figure out if it is, and how can we support their ECS so they're not going through crazy withdrawals, right? Because there's ways of supporting people so that they can have balance and have more easeful breaks as well. I will say that something that both myself and Megan have seen, and like the people that we support, and also like through social media, is that this isn't happening with people who are just using flower. This is happening with people who are using vape pens, who are dabbing and using heavy concentrates. So I think that there is a clear delineation here on what we're seeing, and I can appreciate like how taboo or like provocative this subject is, because it inflames people because nobody wants their use questioned. But this is a powerful plant and it deserves respect. And the only thing it asks is for us to understand how to use it, and for us to like listen to our bodies, and people just don't. So people come to me and they're like, do I need to take a tolerance break? And I'm like, I don't know, let's check in with yourself. Like, how are you feeling? Why do you think you need to? Like, I'm not gonna tell you, I don't live in your reality. So no shame, no guilt, let's just have a conversation.
Yeah, there's so often I hear, I just need you to give me permission, Eloise. Yeah. Like, well, let's talk about that. I think really the work that you're doing is around education and educating the consumer, the patient. And so, Elisabeth, we know there's a lack of education in nursing professionals. It's been lacking for a long time. Can you speak to your work in educating nurses?
So I always start with why. We have to start with our why. Why are we doing this, right? It's heartbreaking when patients come to us and they say they failed their treatments, they failed chemo, they failed radiation, and they failed pain management, etc. And they're looking for answers. And so, you know, they haven't failed, healthcare is failing them. And that is where we need to start. And when you say that to them, they're like, oh wow, you're right, it is. What do I need to know? And that's where we start with the nurses, right? Nurses need to know that cannabis as a medicine has been used for thousands of years. And then fast forward to the pleiotropic benefits that we can have across the board and what this looks like. And parlaying it into conventional care and side by side. Teaching nurses about the endocannabinoid system and cannabinoids and terpenes and how it all works together. Teaching them that this is, you know, something that that they don't need to be afraid of, and how they can then, once they learn, be the game changers in their own communities as advocates and working side by side with their conventional peers and being that bridge. So, you know, and then from pediatrics to geriatrics, you have to understand how to change that conversation. Depending on who you're speaking to. Is it a millennial or is it an 80-year-old? They have a whole different take going on in their head. And so being able to meet them where they're at, right? But so, you know, in Holistic Care and Integrated Nurse, we teach people, you know, the basics, and starting with the history, and then going through all of the different cannabinoids, and really going into, you know, synthetic versus phyto versus endo, and really saying, you know, that we make these compounds in our body, and all we're doing is bringing ourselves back to balance and homeostasis with these compounds. And it's not even just CBD and THC, all the minor cannabinoids, and then all the different routes of administration, and the pharmacology, and then the basics of dosing, and then the deep dive in dosing, and the pharmaceutical interactions, and everything that they need to stay abreast of, as well as then the conditions best suited for this. And then along with starting protocols, to give them some running room on how to really bring this into their daily work. And then, you know, the difference between nursing and coaching, because most of this is coaching. And we're there to be their advocates and to guide and lead them, but it's not necessarily cookbook medicine, and we don't have protocols for everything. We guide them and then teach them to have empowerment and agency in their own body, which is new to them, and taking them away from the pharmaceutical model of taking a pill for every ill. It's very, very different. And so, you know, nurses have a lot to learn, but they light up. Every nurse wants to do this because they know that there's a better way, and they know that patients are suffering. And so when we empower them with all of the things to put together in a toolkit, and then of course we host a monthly mastermind, which gives them a business building toolkit and the clinical and business development that they need to fast track into setting up either their own practice or being that representative wherever they are in their own conventional setting.
Yeah, thank you. I think you really touched on the grand scope of information that nurses need to learn, and I think that other piece that I encounter a lot, one of my favorite stories is when I started at Stanford, and my colleague was training me for the first 10 weeks, and I was purposely brought in because of my cannabis experience to help patients who have been complaining about only being given opioids as an option for their pain. So I have free range to talk about cannabis, and on one patient that we had seen together, at the end of the visit, I'm documenting in the chart, well, here, I want you to go to this dispensary, and I want you to pick up this product, and I want you to take this much and this often. And my colleague, who's also a nurse practitioner, turned to me and said, "What are you doing?" And I said, I'm documenting in the chart. She goes, "Can you do that?" And I said, "I don't know, you're my preceptor." And she said, "Well, aren't you endorsing it?" And I said, "Well, what's the difference if I'm telling them to go to CVS and pick up their opioids?" And she said, "Okay." So there's a lot of stigma and misinformation, and I would even say paranoia among healthcare professionals around educating and treating their patients, and we have to address that as well. And I think, that kind of leads into you, Nurse Laura, about, you've done a lot of advocacy work, and can you tell us why nurses are an important role in advocacy and the legislative process?
Yes, thank you so much. And that story is such a great example, because I think there's just so much fear. There's so much fear, and mostly, really, the fear is around money. Once again, it always comes back to money. Hospitals are afraid if they allow cannabis in their facilities, if they talk about cannabis, if they teach the nurses about cannabis, that they're going to lose funding, especially, some of the bigger research hospitals. I'm from Hopkins. I love Hopkins. I love my peers at Hopkins doing research. I love University of Maryland now. I love University of Miami. Okay, enough. But everyone's afraid that they're going to lose money. And so being out there in your state, since we're working on rescheduling Schedule 1 to Schedule 3, something, it's moving the needle. It's not enough, but at your state level, you have a little bit more opportunity. And we have ACNA here, member, wonderful organization. This other organization that was briefly mentioned, the Cannabis Nurses Network, they implemented a couple years ago a law in California called Ryan's Law, which allowed medical cannabis use, non-smokable, for hospice patients in their end of life. I guess hospice means end of life, but and we took in Maryland a copy of that and modified it some to make our legislators happy, and tried to get it passed in Maryland 2 legislative sessions ago, and it never even got to a vote. But we had almost every person on both sides took a meeting with us and said, yes, I'll support this. It's a good thing. But then our opposition was the Maryland Hospital Association, and those stakeholders mostly were worried about, if we allow this, will we lose our funding? So 2 summers ago, I worked offline with them. We wrote a policy, and by choice, Maryland Hospital Association and hospital systems now are implementing a policy where they will allow, again, non-smokable with lots of criteria, labeled medical cannabis products. Don't, if you live in Maryland, don't go to Hopkins and say, Nurse Laura said I could bring my cannabis. It's not that simple. But there's movement, and there's a policy, and more long-term care facilities are doing that. I work with, I have a contract with a company called Brightview. They're in like 8 states, where they want not only medical cannabis, they're like, people live here. We want them to be able to use adult use. We want them to be able to use cannabis. They live here. And so just trying to keep everyone safe, right? Reduce harm. So there are ways to do it. You really have to get engaged in your community. You have to talk to your legislators, and I'm happy to help. I'll go wherever you want me to go. I'm happy to help support you, because it's so important. And those legislators, like when you sit, especially in your state legislature, where like it's your person is sitting in maybe a U, and you have your 2-minute testimony on a bill, if you tell a story, even just like some of the stories we told, the jaws drop. Like, they have no idea, or they start talking. They're like, oh, my grandmother died before she could get cannabis, or my father. There's so many stories, and they just don't know. They have so much to read, so much to do. They need to hear the in-person, and especially when it's a nurse. Like, I'm kind of known for wearing hot pink scrubs. So I go down to Annapolis in my hot pink scrubs. Everyone knows, here comes Nurse Laura. And it's not because it's about me. I hope you know I'm not. It's not because it's about me. It's because it gets attention, and they know I'm a nurse, and it matters.
Thank you, Laura. I think it's also important to talk about the evolution of these laws. Ryan's Law allows anybody with a year or less to live to now be able to use cannabis in healthcare facilities, long-term care facilities, and I think they've even expanded it now to 65 and older with chronic pain, chronic illness. And I think there's still a lot of work that needs to be done, because when we were working on implementing and rolling this out at Stanford, the Ryan's Law, I remember talking to the committee and saying, okay, you've put this law out, you're now asking your staff in the hospital to document this. Patients can only bring in their own cannabis. How do you know what's in it? And they said, I said, how are you going to educate the healthcare professionals about what if they're having a reaction? How are they gonna know it's cannabis? Because it's always the first thing we blame, right? And the committee said, I don't know. And I said, well, who does? And he said, the chief of staff. So I was fortunate enough to get a conversation with the chief of staff at Stanford who wants to see this actually replace opioids. So there's a lot of support there, but the education is very slow. So EMAC, how do we bridge this gap between healthcare and the medicalization model and cannabis, and how will rescheduling impact that intersection?
Well, I have a dream. I have a dream. It's a big dream, right? With rescheduling, I do believe that at some point nurses will be the frontline employees at dispensaries and even product companies, and that they will be the difference makers focusing on clinical care and wellness, because nobody at the dispensary is focusing on that yet. And then imagine when dispensaries then have to have a medical door, right? So we have an adult use door, but we need a medical door where patients can walk in and we'll have one-on-one and small group coaching rooms where they can get the education and guidance that they need. And then the product mix will shift back to, medicinal formulations, high quality tested, and various dose forms that don't revolve around high THC and potency and having that be all the buzzwords, right? Because we've had too many years of that. And then picture then disease management companies and patient advocacy groups that are then looped into MSOs and then health plans staffing cannabis nurses as care managers. That also has to happen. And then envision a further future where insurance companies and workers' compensation programs will start to cover and fund the CBD care. That's another iteration that we're going to get to, and we know that we will, but it's going to take a while. Patients will be able to use HSA funds and cashless ordering systems and digital tracking from medically focused menus. And then traditional healthcare will finally intersect their data systems with cannabis tracking apps that are measuring prescription pharmaceutical reductions, improved outcomes, and lower costs of care, which again, we know that will prove in time. And importantly, medical and nursing schools will start teaching care of the endocannabinoid system as a first-line therapy and not just as a last resort. So it's a big dream, but I do believe that we're going to get there, and we can all and embrace this future and walk together, because there's strength in numbers, and we can't back down, because the change is coming. But healthcare is stubborn. I've been in healthcare 40 years, and we've talked about patient-centered care for as long as I can remember, but when do we deliver it, right? And I've been a nurse, and then I spent 20 years in insurance companies in operations and sales. And none of them talk about it either. It's just all about how we finance it and fund it. But who knows that we're spending $4.5 trillion in healthcare in this country, and we're still placing near last in the 50 developed countries in outcomes. That's a travesty. It's not just opioids, but all kinds of chronic disease mismanagement. You name it, from epilepsy to neurodegenerative diseases to cancer therapies. And when is we're going to be able to test those medicines that people are bringing in and say, this is a fully extracted cannabis oil. They're testing it at 70% THC or XYZ CBD. And now we're understanding how to fold that in with the rest of the other things on that treatment plan. We will get to that, but it's still an uphill battle.
Yeah, I think that's crucial. There's such a lack of health equity for patients who want to use cannabis as a treatment, and the patients that we serve at Stanford, 50% of them are local, the other 50% come from mostly rural communities, and those are the ones that can't really explore cannabis as a treatment modality because of the expense associated with it. And, their other medications are 15 cents for 90 days, so it really makes it difficult for them to make those choices. Basima, I'm curious, what are some best practices for product development and consumption for patients?
Well, one thing we all can agree on, especially from listening to all the panelists on the stage today, is the common concern about safety and the lack of education. And it's no secret that the prohibition of cannabis and the propaganda has set us back completely. That led to a lot of unfortunate bad experiences for consumers. So my idea is to take charge and start creating more positive experiences. And we really need to, like Laura said earlier, there's a lot of different regulations from state to state, but it doesn't mean we can't regulate ourselves and be accountable for our actions and the actions of each other. So I feel like the best practice is to keep education and safety at the forefront of all decisions. And I wanted to do my part by creating the B3 movement, and that stands for being intentional, being informed, and being safe about all cannabis practices. Whether you are a cultivator, a IG influencer, a consultant, you have a responsibility to make sure that you or the person is informed about what's happening, are intentional about the use of cannabis, like a microdose and like Megan talks about, and it's safe, not just safe in the practice of consuming, but what is your state laws around cannabis? Are you storing it correctly? Are you traveling with it correctly? All this is important to start manifesting positive experience, because with more positive experience, we start to break down that wall of stigma that's been hindering cannabis, especially in cannabis medicine. So one way I do that is through projects, through the movement. So for example, I connected with the cultivator here in Florida, CQG Farms, and me and her made educational videos, so she was able to bring flower buds from her farm and show visuals to people of what it looks like to have a bad flower bud versus a good flower bud. And I was there to give my input as a nurse to what to do if you consume something bad, how to combat that. So our partnership helped kind of reinforce the being intentional, being informed, being a safe aspect of the movement. And this could be done in many ways. I could connect with influencers to create videos. I could connect with, different consultants to do projects, to do speaking engagements like we are doing today. It's finding your unique way to spread the message of safe consumption and product development, because we all have a responsibility to each other. And until the government can catch up to us, I am determined to do my part.
Thank you. That reminds me of act local, think global. Still works. Okay, Miss Megan, there are some unique ways that people can consume cannabis. Want to tell us a little bit about some of the unique products you've developed and the work you're doing there?
Sure, thank you. So when I started Trusted Canna Nurse a couple years ago, I didn't have an intention of having a product line, but then when I went to go to recommend products to patients, I had a hard time finding, high quality whole plant and minor cannabinoids in the combinations that I wanted. So that's when we developed our own line of, we have topicals, tinctures, edibles, and even suppositories. And through this work, we partnered with a former NFL player, Gilbert Brown, Super Bowl champion, on creating a product targeted for people with previous head injuries. So that's been a really, really cool project this year. And we've also partnered with the Relief app and the Canigma on doing a market study on our CBD suppositories for women's health, because this data does not exist in research. And I think it's so important that we're collecting objective data on market products so that we can actually see how they're working, as opposed to developing this pharmaceutical. Why can't we take a whole plant product and see how this is working for this problem, for this population? And Mack is doing that with one of her products as well. So that's been really cool to be able to develop something and then actually test it and collect objective data on it that's missing.
Yeah, that is really such a great, unique way for nurses to create their own path, like you said. And I think, Ariane, that kind of brings us to not only what makes a well-rounded cannabis nurse, but who do you go to? Who's your mentor? How do you learn these things? I think about nursing school and how we have preceptors, and it's really hard. You can get the knowledge that we've talked about today, but if you don't have someone that you can share that knowledge with and really incorporate it into your everyday life, you can lose it pretty easily, right? So tell us a little bit about what you think about that.
Yeah, so for me, I've been doing this for a few years now. My dad was my first patient. I helped him come off of opioids. He has a history of opioid abuse disorder and pain, and we got him off with cannabis, and he's been sober since, and that was almost 4 years ago now. But as far as being like a well-rounded cannabis nurse, like it's definitely more than just being a cannabis nurse, right? It's working from a holistic practice, because as cannabis nurses, we're actually working with the endocannabinoid system. So, and it's the understanding of that, right? And it's hitting it from a holistic standpoint of nutrition and focusing on gut health and looking at like mindfulness-based practices. I mean, it has been researched that mindfulness-based practices like yoga and meditation can actually naturally increase our endogenous cannabinoids that we already make. So it is understanding how to truly support the entire body and the whole person outside of just using cannabis. And that was something for me, like when I really started like going into this stuff a few years ago, and one of my first clients, it was a whole hour call, like we talked about diet, nutrition, like the whole thing, right? And when we were done, she was like, oh my God, this was way more than just a cannabis consultation. Like I thought we were just gonna talk about cannabis, and you're talking to me about my whole body, my whole thing, and all of this stuff. And I was like, well yeah, this is how I work, right? And it was in that moment, I was like, oh God, like I am so much more than just a cannabis nurse. I am a holistic health and wellness nurse, and I work with a multitude of modalities, including psychedelic medicine as well, and education and stuff, and yeah, just take a very patient-centered approach with it, but from a lot of different ways, right? And that's what I have seen, you know, like Megan said, don't quit your day job. And also like doing it in a holistic standpoint, and just knowing that cannabis is just one tool is what I feel like has really helped make money. Yeah, it doesn't exist on its own, so that's where I'm at with it, and doing it that way.
Yeah, and how do you stay fresh and relevant, and how mentorship maybe a little?
Yeah, thanks for asking. That's a great question. I am involved in multiple consultation groups. I'm in a psychedelic consultation group. I'm also in a cannabis consultation group. I did training with Daniel McQueen out at the Center of Medicinal Mindfulness for psychedelic cannabis and therapeutic cannabis. And I'm active in that group as well, and we have things that we do together. So a part of the integrity with this is like not only going out and doing it and practicing it, staying relevant, but also like staying within community and regular mentorship. CNN is a great resource for me when it comes to staying relevant as well, and like tapping into my mentors that I have in there. So that's what I do.
Wonderful, thank you. I think that was our last question. So we do have time for questions, but I think I'll also put out to the panelists, what is one thing you would tell aspiring cannabis nurses? How about I start with this? Whoever answers my question right can go first. Which state was the first state to have a medical cannabis program?
California.
Wrong. Elisabeth, Mack, New Mexico. Y'all thought it was California.
New Mexico, well, California, 1996, right? Prop 215 we passed, but back in the 70s, New Mexico.
1978.
1978. They were the first to have limited diagnostics, right?
They had a medical cannabis program, but they had no way to get the medicine to the patients. In fact, their idea was that they would take the confiscated cannabis and marijuana that the police would take and give that to the patients of New Mexico. And the health department quickly came in and said, I don't think that's a good idea. So,
but soon, you know, we're going to have FDA-approved pharmaceuticals, right? And that's
we already do.
Well, I know, right. But new ones, Schedule 3, right? Schedule 3 is big. You know, for us. As clinicians, it's going to be able to give us more to talk about other than Marinol and Sesamet and Epidiolex, which are very limited. I'm looking forward to seeing one-to-ones, more of a Sativax type of a blend that we're going to be able to have covered. Because again, it's not just the access in our 38 legal states, it's financial access and affordability. And so that's going to help change the conversation once rescheduling really starts getting into mainstream. We see a trickle of it, but then also eliminating 280E. You know, I talked about nurses being the game changers in dispensaries as frontline employees on the medical and the wellness side. And that is going to be significant because dispensaries don't have the money to hire. I've been in California, my whole life, just about, and it's hard, in San Diego, Palm Springs, any place I've lived, to try and have a medical door in this dispensary because of 280E. But if we eliminate that, they're going to have greater profitability, more stability, and then they'll be able to hire and train other nurses as well as bud tenders, even to be up a level, although they should really stick to more of the strains and that sort of thing, and helping people to enjoy recreation safely as well. But once nurses are able to work more in dispensaries, when profitability increases, I think we're going to see a sea change of people going to dispensaries for that medical door.
Yeah, I just want to add there, Nurse Laura here. Dispensary, raise your hand if you own a dispensary. Okay, well, just so you know, if you own a dispensary, this 280, this tax, it's the amount of money that dispensaries pay in taxes. It really is astronomical. When the people that you might know complain about how much money they pay in taxes per square footage, they're not kidding. I mean, it really does cut into the profits. It really is a big problem. So Schedule 3 will help a lot with that, and will free up the money to allow dispensaries to hire clinicians, nurses, pharmacists, and doctors. And patients are so much more loyal to dispensaries that have an active medical person. Some dispensaries, you can raise your hand if you know any, are maybe owned by a doctor or owned by a nurse, owned by a pharmacist. None? Okay, well, I know a couple in Maryland that are owned by doctors, and those doctors aren't even active with the patients, really. They just own the dispensary. But just knowing that, I have patients that say, oh, well, I'm gonna go to that one because, so-and-so, I won't name drop, owns it. And so I find that the dispensaries that actively put my face on their website, like we have Nurse Laura, are much more loyal. They'll drive farther to shop at that dispensary because they have this access. Because it is like free integrated health coaching. They call me up, again, what gummy should I take for nighttime? I'm like, well, hold on. Tell me about your sleep. And so it's really true. It makes a big difference. I want to just quickly answer your question, then I know we really want to hear from you guys. But I think one of the most important things, because nurses love education, if you're like me, which I'm guessing you are, if you're a nurse, you just want to go back to school. We always just want to go back to school. And I'm a huge fan of University of Maryland's program. In the few years that it has been up and running, it continues to get upgraded, get added to, get rewritten. It is a great program, and it's open to anyone with a certain criteria. You don't have to be a healthcare professional. And it's a great program, and I think people are coming out really able to provide education. They're not the same as a nurse without education, but it's a great program. I think nurses really need, besides getting education, to join a group. ACNA, Cannabis Nurses Network, so American Cannabis Nurses Association. I'm gonna put in another plug. Tomorrow is the breakfast, and you can sign up and get information and meet some of the nurses, like myself, who are in that group. And then the Cannabis Nurses Network. They're different, but both wonderful and full of amazing people, a lot of overlap. Or my organization that has the people besides nurses and doctors and pharmacists. You really need the support group. You need to be able to discuss your patients confidently, be able to review research together. Some of our friends that are presenting at this conference have monthly webinars that are amazing. Again, it's presenting the data, presenting the research, but having the discussion, question and answer, and being curious is the most important thing.
Anybody else want to, Seema, you want to add to that?
Yes, I just wanted to ask what advice would we give to aspiring cannabis nurses? I would really encourage people coming into this space to stay open-minded and empathetic, because not everyone can get a cure right away. There's so much work that still needs to be done in cannabis medicine. So being a nurse, you have to look at the patient and be open-minded, because what works for me may not work for you, and what works for you may not work for me. And the main focus should be giving the person the best quality of life as you can. So everybody's modalities is gonna look different, and they're open to every type, whether it's herbal, pharmaceuticals, just being open to be ready to facilitate a plan for that person. Because like myself, I can't be strictly off pharmaceuticals, and a lot of cannabis nurses are like herbal this, herbal that, but what do you say to the person who can't take the metoprolol out of their regimen yet, or the antiviral medication out there, their regimen yet? So being able to work and understand, and if I come to you and say, jumping out of planes helps me with my quality of life, you're gonna need to learn how to incorporate that in my care plan.
I don't know if I want to throw you out of a plane.
But it's a good point, you know, understanding both sides of the treatment plan as well, right?
Yeah.
The pharmaceuticals, the herbs, and the cannabinoids, and being able to interlace them for that patient, because it's an and. You know, we talk about this, you're not gonna go off all of your drugs just because you found cannabis. You're gonna reduce, but it's not something that you can just say, I'm gonna stop taking pharmaceuticals. But over time, you know, that is the goal. And as far as conferences, you know, kudos on all of you for being here. Attending conferences, Cannabis Science Conference, American Cannabis Nursing Association, Patients Out of Time, American Holistic Nursing Association, that's coming up next month in June. You know, all of these are good places where you can go and learn more about the intersection of cannabinoids and cannabis nursing and holistic care, because it is body, mind, spirit, going back to Ariana's point, and getting people to be able to relax. If we can get into the relaxation response, we can heal. But how the hell do we do that in this modern society?
Yeah, I think it's really important to push the envelope too, you know, and with our colleagues. One of my favorite advocacies for a patient was, you know, he's a 44-year-old colon cancer patient, and cannabis worked for him. And he got into a clinical trial, and his clinical trial team said, you have to stop the cannabis. And when I called them, I said, why? And they said, well, we don't know how it interacts with his other medications he's taking. And I said, do you have data on how his opioids, his trazodone interacts with his trial meds? And they said, no. I said, well, it sounds to me like there might be some bias here. And they said, okay, he can use his cannabis. So, you know, it's important for us, you know, and I'm comfortable in that role now because I'm educated. So really, the more education, I think, the more we can start to push some of those preconceived notions and really advocate for our patients in unique ways. We do have a little bit of time for questions if anybody has any for us. We won't be offended if you don't.
I have a question.
Yes.
Hi. How do you toe the line with dosing protocol? You can't, you know, say take 0.25, blah blah blah. Like, how do you kind of toe that line of here's what your product recommends? Should you go up? Should you go down?
I'll take this one. Great question.
I'm an advanced practice nurse, so I can.
Yeah.
I'll let the nurses answer that for you.
Yeah, so the question was, how do we toe the line with giving dosing recommendations without giving dosing recommendations as RNs, which is a fantastic question. So really for us, it comes down to educating the patient on what works for, this is the terminology that I use, that kind of Laura taught me to use, that a lot of patients like to start with this dose, or a lot of patients like to start with this much of a dropper, or, you know, I might say 10 milligram gummy is a really high dose for a lot of people to start with, and they don't like how they feel in it. So a lot of people like to start by cutting that into like quarters or even smaller. So kind of using that language without saying, take this 5 milligram gummy, you know. I don't know if anybody else has input on that.
Yeah, I would like to add to that. There's a saying in the space that says, start low and go slow. And that's very important. You can always add more, but you can't take it away.
Amen.
We do have some interventions that will help, you know, correct if you overdo it, but we don't want you to get to that point. And then to just put out there with CBD, sorry. The people take THC, they know that it's working because they can feel the high effect. But CBD, you don't really feel anything like that. And what I tell people is, how do you know that the CBD is working is, notice that you could do something that you wasn't able to do before. So if it took me usually a half hour to get out of bed in the morning because my body was aching, and I noticed today I got right up, then maybe that's an indication that the CBD is working. So it's important to start low and go slow and pay attention to your body. And keep a log, like a lot of us give to our patients. Document everything. Nurses love to document. And just keep track of your progress.
Yeah, I think it's really important, and not all cannabis nurses or people who call themselves cannabis nurses do this. It's really important to protect your license. We have to be careful. I want to keep my nursing license. That's why I don't administer some of the psychedelics that I might coach or educate on, but I don't administer any psychedelics because it's not legal in my state, right? So it's really important. So often people will finish a session and they're like, okay, can you write that in an email to me? I'm like, no, did you take notes? Here, let me help you take notes. You can take notes about what we talked about, but I'm not sending you a prescription over email. No, thank you. I'm not gonna do that. And I have all kinds of disclaimers and all kinds of forms that people sign, which sounds like a bunch of legal jargon, but we have to protect our licenses. We worked hard to get them, and we're nurses for a reason. So it's really important to try to be as by the book in this gray area as we possibly can.
Start low, go slow, but don't also stop when you get where you need to go. So don't keep pushing it. And also reiterate patience. Right? With the pharmaceutical model, you feel those drugs. With THC, you feel that. With CBD, you often feel the other pharmaceuticals you're taking. So you'll start to notice that, right? And or they'll stop taking it, and they're like, oh wow, now I really understand how much that was helping me, because now I can hardly move. And that's where you get the education. That's the aha moments, and you're drawing them in touch with their own body as well, right? And that's what we need to do, because we've been so disconnected.
Yeah, I was just gonna, Mack actually said it. Like, the thing with cannabis dosing and the way that I approach people is, like I said earlier, all that cannabis really wants from us is for us to understand how to work with it and how to work with ourselves, right, by using it. And so it really is a practice of bringing people back home and having the autonomy to make the decisions for what they need with their life. So it's very much so like an empowerment thing, right? And when I think about it in a way of how do we educate patients on titration and dosage and stuff like that. It's like, well, we know how to teach people who are diabetic how to track themselves and how to listen to their bodies. Can we apply that thought process when we're working with people to empower them in their cannabis use and really, what's your dose? Because what works for me is not gonna work for you or anybody else, right? This is a real opportunity to build relationship with self while you're empowered in the medicine you use.
Thank you, personalized medicine. We have time for one more question. I think someone over here had their hand up. Yes.
So my wife and I work with patients or clients, and she was focused on the cannabis side. When I came in, I started looking at nutrition, and I started asking the patients for their lab work. And I said, if you don't have your vitamin D levels, your B vitamins, ask your doctor for it, because that seems to interact and support the liver, which means you need less cannabis, in my experience, than if you had poor nutrition, because you don't process it as well. So with the cannabis premises, I found that it's usually a higher amount of THC, but if you can get them great nutrition, then the rate of hyperemesis tends to drop off, just because you can titrate back on the THC. Have you looked at the labs for patients and correlated vitamin D or B vitamins, magnesium, and other labs to improve their quality of life in your practice?
I do ask for labs sometimes if the patients are willing to share them. I'm not a nurse practitioner, I can't order labs, but I do review the labs. And interesting, not so much what you just shared about CHS, but particularly with parasites and that whole gut-brain axis. Man, the people with parasites have so many issues. So we do, again, we mentioned this earlier about being the bridge. I'm not trying to replace the doctor. I'm not a doctor, I'm a nurse. I want to be a nurse, but I want to be the bridge back to the doctor. I want the patient to be talking to their healthcare provider. I'm often encouraging integrative medicine providers, but talk to your doctor, get those labs, let's figure out what's going on. Let's not just find a diagnosis. Let's look and just see, are your electrolytes balanced? Are your hormones balanced? What are we doing naturally for your endocannabinoid system? And let's get your gut healthy.
Yeah, thank you so much, everybody. That is our time,
you for
so thank
having
you
us.
to our panel.